Hello, my name is Caitlin Broniker. I am going to discuss Sentinel events. In this PowerPoint, I am going to discuss Sentinel events, root cause analysis, system failures, and current practice. A Sentinel event is a patient safety event that reaches a patient and results in any of the following: death, permanent harm, severe temporary harm, or interventions required to sustain life. Such events are called sentinel because they signal the need for immediate investigation and response. Each accredited organization is strongly encouraged, but not required, to report sentinel events to the Joint Commission. Organizations benefit from self-reporting in the following ways. The Joint Commission can provide support and expertise during the review of a sentinel event. The opportunity to collaborate with a patient safety expert in the Joint Commission's Office of Quality and Patient Safety. Reporting raises the level of transparency in the organization and promotes a culture of safety. Reporting conveys the healthcare organization's message to the public that it is doing everything possible proactively to prevent similar patient safety events in the future. The term root cause analysis is a technique used to study accidents in many high-risk industries, including aviation and space travel. It became the tool of choice for hospitals to buckle down on error analysis. Two system failures that I believe could lead to errors in today's practice is no staff education before dispensing non-formulary drugs and insufficient drug information. These two failures contributed to the event in the article by providing insufficient drug info and not providing education to staff before dispensing non-formulary drugs. As nurses, most of the time we are going to be unfamiliar with non-formulary drugs. We do not give these often, therefore we are unfamiliar with them. There is no staff education before dispensing non-formulary drugs. We do not learn about non-formulary drugs in school. Staff are not educated before dispensing non-formulary drugs. Research being done today is focused on clarifying orders, prescriptions, directions, and parameters before administering formulary and non-formulary drugs, as well as educating staff on the importance of verifying the patient, drug, dose, frequency, route, parameters, and any lab monitoring required. Staff are also being educated on resources available with administering non-formulary drugs such as compressive drugs guides, electronic databases, drug references, pharmacy, and the chain of command, consisting of charge nurse, team leader, nurse clinician, and nurse manager. Recommendations. Hospitals today are working towards ways to reduce medication errors in hospitals by pharmacy participating in conducting medication reconciliation, checking patient allergies at the bedside, establishing protocols to respond to adverse reactions, discussing medications with open-ended questions and active listening, providing accurate lists of medications to be taken home after discharge. Current practice. This can be applied to my current practice by ensuring all of the implementations are being practiced on my patients. With lack of time being a factor, some of these implementations are not always practiced. Nurses get busy and overwhelmed. They can look at the list of allergies on the computer and click verified, even when they were not discussed with the patient. Sometimes we do not have time to discuss medications, though roughly as we would like. Pharmacy does not always reconcile medications for patients, therefore it is the nurse's job. It is important to be aware of sentinel events and how to reduce them. With medication errors being one of many, it is crucial for nurses to know how to avoid sentinel events associated with medication errors. Hospitals and healthcare facilities need to be aware of how common medication errors are and how easily they can be avoided when aware. Hospitals need to educate nurses on how to respond when put in a situation when there is a potential for a medication error. Nurses need to be conscious of the resources available. And these are my references.